Performing tabletop exercises is a good method to get community stakeholders together. One of the main things to remember is that being prepared will save lives. Whether you perform your tabletop exercise with community members and organizational staff and personnel, or if it involves a full-scale exercise in dealing with those same community members, but also including the local, state, federal, or jurisdictional agencies performing this full-scale exercise, they will be beneficial to your community. Any type of training will assist in minimizing dangerous conditions and life safety issues that may arise. And this is by no means an easy task to establish a full-scale exercise, so keep that in mind. It takes much time, planning time, and utilization of the resources throughout the community in order to do such an event. Looking at areas to start in, well, performing a full-scale exercise is working with your local community stakeholders. These stakeholders have a wealth of information as well as having many resources that may be used during the full-scale exercise. On the other hand, the same community resources may be used during the actual event. Thus, it is imperative to research and to meet with these community resources prior to an event, but more importantly, train with them regarding some of the types of disasters that are within your community and within your area. One of the main focal points for any full-scale exercise is forming the research, but also be willing to communicate with the community stakeholders and leaders that will be imperative and most influential through the actual full-scale exercise. On occasion, this will entail holding meetings at least one time per month in order to get the full-scale exercise up and running. You'll need to define these community stakeholders and divide them into groups in order to facilitate all the planning efforts that need to be accomplished in a short period of time. Normally, this takes approximately 10 to 12 months, and in some cases, actually, it may take a year or more to actually sit down, plan, execute, and develop a full-scale exercise for the community. Some of the research that needs to be done in regards to this type of exercise will be taking the plans from the city, or perhaps looking back and researching at some previous events that may have happened during the past 10 years. A local hazard vulnerability analysis may have to be excavated as well, and having this hazard vulnerability analysis may be the key to unlocking some of the areas that may need to be trained upon within the community. And in essence, this may change up on some researching for those hazards in order to be contemporary with your full-scale exercise. So let's take a look at some of those key elements that need to be included within the full-scale exercise. There are some key elements for this exercise in making a list of objectives that need to be met. Now, these objectives will be the key foundation for performance levels within the full-scale exercise. There should be not too many of these objectives out there that need to be written down. Some may be complicated, some may be convoluted in some instances, and the exercise then will not be realistic. In order to realistically meet those objectives, there should be a minimum of 5 objectives that need to be met. There may be several stakeholders that may feel the exercise was not complete enough. However, there are situations where these objectives need to be met concisely, precisely, and in an effort to have life safety in mind. The realization and the needs, as well as prolonging the event, may have been taken care of right up front in planning for the full-scale exercise. However, these objectives should be directly related to that type of event that is going to be trained upon. A good rule of thumb is to have approximately 5 objectives that will be listed and that will be able to be tested and accomplished during a full-scale exercise. This not only shows that there is the ability to work alongside others collaboratively, but it is also keeping in mind the focus concerning the full-scale exercise and its site. One of the first things that needs to be accomplished in the exercise, aside from the objectives, is being able to meet with all the community stakeholders and planning out exactly what needs to be done regarding any types of personnel that may be used, the location, the type of disaster that will be used, and building upon those scenarios for any types of props, logistics, and perhaps publicizing with the local radio or newspapers within the community. Any type of emergency response requires the media. Thus, the media should be included in all these full-scale exercises, whether as a player or just promoting it. We have to take a look also at what costs will be incurred regarding this full-scale exercise. Oftentimes, there may be enough resources in grant funding that can be used in order to perform a full-scale exercise. On the other hand, if grant funding is not available, there may be some issues in performing this type of exercise. Local area and community representatives participating in this exercise may include local theatrical groups that you may use as patients, should they be willing to perform such an act, as well as faith-based organizations participating in these scenarios. Once the objectives have been established, the type of scenario and community stakeholders that are involved in the process will be finding time now to exactly the date, location, as well as the references and resources within the community that will be needed to perform this event. If your exercise, for example, happens to be during the school year, the likelihood of having children or adolescents involved in the exercise may or may not be impacted depending on the time of the year. On the other hand, summer vacations, classes being let out for summer break, and a probable lack of interest for performing such an exercise during the summer months may be some of the areas to contend with when developing. So it is important to choose wisely the time of year and when this exercise is going to actually take place. A good full-scale exercise will include the following: your local, state, and federal agencies, other faith-based organizations that are able to provide their input and solutions as to what may take place, and, of course, the American Red Cross. An example of a full-scale exercise that may be contemporary in this day and age is dealing with an active threat or active shooter full-scale exercise. Depending on the type of organization that you may work alongside and whether or not some of these areas are made available to you, it may be applicable to use a floor or an empty hospital unit that may be available or that is currently not being used for quite some time. Obviously, permission from representatives within marketing and risk management will be imperative to the success of the full-scale exercise, as well as seeking permission from your administrative officials. Working with the local enforcement agencies, fire departments, EMS providers, as well as those within other hospitals in the surrounding area will also further the success of this exercise. It may take several weeks and perhaps years in some instances to actually facilitate such a full-scale exercise. On the other hand, being able to formulate and bring so many community representatives together is obviously beneficial to the local community, the stakeholders, as well as the organization internally. Much planning will be needed in the advent of creating your document for your full-scale exercise. Your document will need to be comprehensive, as well as listing all the players, observers, and the facilitators that will be running the exercise. You will also need to have an appendix listing all the acronyms and the abbreviations that are being used throughout the course of the exercise. The scenario will also have to be mentioned within the document for participants to get the general idea of what the exercise will entail, as well as any changes that may have occurred during the past several weeks. And in a good functional exercise, it will include emergency public information warning systems, as well as phone numbers to the emergency operations centers, emergency management, public safety and security response, urban search and rescue, and of course, fatality management. In order to commence a good exercise, the players will need to understand the initial incident notification, the initial response, and the ongoing operations of the incident and what those operations will entail. One more good rule to follow in regards to the exercise will be providing a background and research information on the topic, whether it's going to be using statistical data or whether it's going to be using any type of current and contemporary research in regards to active threats or active shooters within hospital situations. You may wish to include the type of profile that an active shooter or an active threat may have. Once there is an understanding of the need to conduct a full-scale exercise, then a step-by-step process must be followed in order to outline what is going to be needed, what's going to be developed, and how to create an effective program in regards to the healthcare organization. Full-scale exercises will take into account that hospitals are trying to build upon certain areas that they feel there is room for opportunity and to improve upon. It is imperative that the organization should be willing to understand what is involved in the full-scale exercise and actually take the time to organize it at least a year in advance in order to meet all the benchmarks that they have provided.